Good day to all, and welcome to Zagreb, and welcome to the third JACPO meeting, which is this year a bit different. So some of you are with us for 3 years, some of you are for 2 years, and some of you are new. But I think that you will find this atmosphere informal and comfortable, and that we will actually have a chance to talk. So first of all, a couple of household questions. The toilet is through the foyer and straight down to the end of the corridor, last door on the right. And for the Wi-Fi, you just pick guest and accept the connection, and that's it. So if you have any more questions, just ask them. So what is the idea behind the JACPO meeting? Actually, we wanted to establish some collaboration, experience exchange in the Central and Eastern Europe region, but not only among patient groups, but also with healthcare professionals, because I don't think that we can work alone, because the cancer is such a problem and such a complex issue that we actually need to work side by side. So today's day is dedicated to the results of the survey that we made, and I would really like to thank you all for your contribution and for promoting this survey in your countries. And the second day, tomorrow, is dedicated to education on PHC. So we slightly changed the format, and this doesn't mean that you will be passive these 2 days, because we actually need you to engage in some discussions. I would also like to thank Croatia very much for having us here and for supporting us in this project. So I hope we collaborate some more on this. And I think I won't be talking too long. And the smartest thing would be to start with the presentation. So how it came to be that we have this meeting. Actually, cancer is a complex problem for every country, so one country cannot fight it by itself. And we all come from very similar backgrounds. We all have very similar problems in our countries. The most prominent one is the increasing incidence and very high mortality. And that's why we wanted to exchange the experience with people from other countries, but also enable you to see where you can partner up, what you can do together, what ideas you can get from other countries, and how can you utilize them in your country. So the problems that we have are definitely the disparities in health literacy within the countries and among the countries. There's also a very wide variation about what patient organizations are doing and how they're active, in what ways they're active, and what are their advocacy activities. And of course we have very wide disparities in cancer care, but also generally in access to health care within the countries and among the countries. So this is the idea that compelled us to try to make this meeting. So for the first year, it was actually dedicated to getting to know each other and to see what we're doing and how we can find a way to work on it. And the last year, we were actually more practical and trying to see what is the common action that we can do. And this is the place where the idea about this survey started. So this is the partnership of 12 countries, and these are the people who are actually behind that. And some of them are not today with us. I hope they will watch us on stream. I will show you a short timeline how it all went. So in June 2018, we came to this idea. We discussed it, developed it, and through the summer and through the autumn, we were developing the questionnaire, and actually there was a lot of communication between us. The first version had like 190 questions, so we had to cut it down. And the final version was ready in December of 2018, and then in January was actually translated to all 12 languages. And from the World Cancer Day 2019, February 4th, and it went online, and thank you once more for sharing. And we were actually surprised with the results we get and with how many people actually responded to this. And I would like to thank, I believe you went to the parliament with the survey, right, in Albania? Yes, Donica, yes. And who went to the Ministry of Health, I believe Czech Republic, yes, and Hungary? No, just Czech Republic, okay. So we finished the data collecting in the May, and now we will show the preliminary results. You will all get the entire Excel sheet with all the data, but you will also get the presentation for your country with charts, so you can use them and see how this information could actually work for you. I'm very pleased and very grateful to all the healthcare professionals that are today with us from different countries. And in the afternoon sessions, when we will actually plan how to utilize this data, I believe it's very important for you to be here and that we try to see how we can work together in countries, but also in the region. And what we actually wanted to achieve, one of the problems in the region is that we don't have any systematical collection of the outcomes and no follow-up on outcomes of cancer care and cancer treatment. And perhaps it's very important to distinguish that cancer treatment is one thing, and this is perhaps what is most interesting for the pharma. But cancer care is a much broader concept and actually means the comprehensive care for cancer patients, caregivers, and everyone involved in the disease. So these are the 5 outcomes: diagnosis and treatment, informations that are actually given to the patients, quality of life, coping and support, and palliative care. And this last chapter was we were all discussing hard on it because it was dubious whether we should ask people about the end of life and how would they feel if they were confronted with such questions. But actually this is also an area where we were very positively surprised how many people responded to that. And this is actually something that we need to talk about. So without further ado, I will give you Assistant Professor Slavica Sovic from the School of Medicine, University of Zagreb, who will actually present you the results. She made the statistics and she made all this data systematically, and she will present them to you. Slavica, the floor is yours.
Thank you. All of you in this room. It is my honor and privilege to be possible to present your results of this survey. Why is that so? My first contact with this survey was when I saw questionnaire we are about to present today. And while I was reading it, what came to my mind was a definition of health proposed by WHO. Somebody maybe knows the definition. Okay, definition says that health is state of complete physical, mental, and social well-being, and not only absence of disease. And this is what all this survey is about. It is about well-being, physical, mental, and social, and not only about disease. And I was really surprised when I learned that. And second thing that I appreciate about this survey is when I realize that the aim of study is to assess and improve quality of health care. And that task is really, really complicated. I will try to explain it in a glance, if you do agree. When we are trying to measure something, first, we have to define that what we are trying to measure. If we are to measure quality, then we have to define quality. And some definitions of quality are excellence, appropriateness, absence of mistakes. And of course, we cannot measure quality according to those definitions. And then when we are talking about quality of health care, situation is even more complicated, and quality of health care is even more difficult to define and to measure. Definition of health care quality depends on viewpoint. So we have situation that healthcare professionals and users of healthcare will define quality in their own way. So overall, healthcare quality is compromise between all stakeholders included. And how we can measure quality and quality of healthcare? There is one paradigm which defines quality as multidimensional. And most commonly used dimensions are present here. Some of them are safety, continuity, equity, efficiency, effectiveness, availability, and so on. They are presented in this first column. And then we measure dimension of healthcare, which is only partial presentation of entire system. And we can measure dimension measuring elements of care, and elements are structure, process, or outcomes of care. Units of measurement are called quality indicators. They will come somewhere in here. And if you decide to measure one part of healthcare system, you will probably find out that there is no tool available or quality indicators, and you will be in situation to develop quality indicators, and then after that, to measure quality of healthcare. And that's what happened to Ivica on the beginning of this project. But of course, to get in situation to develop quality indicators, there are a lot of years of hard working behind Ivica, understanding of patients' needs, understanding of organization of healthcare and social care systems. And from that position, somebody can come to idea to measure healthcare quality and to improve healthcare. Okay. Sorry about that introduction, but I'm teacher and I have need to explain what we are going to do. Now we will start with present of results. Of course, this is presentation of results at a glance. Entire presentation or results you can find, they will be available somewhere on the internet. Yes. Okay, and of course, you can ask questions, you can interrupt me, and so on. Sorry, Ivica, you were supposed to explain this. I will skip it. Okay, we can see then 1/5 of participants filled in questionnaire on behalf of somebody else. Why is that important? If we come in the situation to analyze some personal attitudes or something like that. 1/4 of participants are male. Of course, this does not present proportion of males in population. On this slide, we can see distribution of participants according to the gender in different countries. In North Macedonia, I'm sorry, I'm not familiar with this, sorry. I wanted to use pointer, that was my idea. In North Macedonia, almost 40% of participants are male. That proportion is above 25 in Poland and Romania, and 25 or below in other countries. I was reading somewhere that the Czech government proposed using of this short form. Is that correct? Okay. These slides show us the distribution of participants according to the localization of oncological disease. Sorry. Participants, but by the country. Next slide is by location. We can see that Poland. I'm sorry, I have problems with it. Maybe you can go.
Okay.
Sorry, just go one step back. I have problems with that. Please help me. We can see that Poland, Hungary, and Croatia makes 52% of entire sample. Yes. Okay, here is distribution of participants according to the location of oncological disease. 45% are women with breast cancer, 12% participants with lung cancer, colorectal carcinoma is presented with 10%, and 8% are gynecological oncological diseases. Okay, in this slide, we can see distribution of participants according to the localization of disease by countries. We can see that in North Macedonia, there is lower percent or lower proportion of participants with breast cancer. This is probably due to higher proportion of male participants in that country. What is also interesting is that in North Macedonia and Serbia, there are higher proportion of participants with hematological diseases, while in Croatia, we can see there is higher proportion of participants with lung cancer. More than 50% of participants are women with breast carcinoma in Albania, Bosnia Herzegovina, Bulgaria, Czechia. We can also say Romania, Serbia, and Slovakia. Different but similar distributions of diseases has Hungary and Slovenia. Okay, this slide is really important. It is answer to the question, how was your cancer diagnosed? And we can see that in Czechia and Hungary, 17% of oncological diseases and 15% in Poland are diagnosed in screening programs. More than 20% of oncological diseases are diagnosed as part of JACPO programs in Croatia and Poland. These proportions are higher than 10% in Albania, Bosnia Herzegovina, Hungary, Romania, and Slovakia. And what also? We can see this blue part. At least 60% of oncological diseases are not diagnosed as part of preventive programs, but when participants visit the doctor because they find out that something went wrong with them. And we can see that this 63, we can see in Poland, and it goes up to 94 in Bulgaria. Diagnosis of breast cancer. Around 30% of women diagnosed with breast carcinoma were diagnosed as part of screening program in Hungary and Poland. These proportions are above 20% in Czechia, North Macedonia, and that's it. Above 10%, we can see that percentages are related to Albania, Romania, Serbia, and Slovenia. And again, here, we can see that over 60% of breast carcinoma, breast cancers, were not diagnosed as part of preventive programs, but when when women visited their doctors because something went wrong. This one is related to colon cancer. Congratulations to Slovenia compared to the other countries. 27 participants were diagnosed as part of screening program. These proportions are 15 in Hungary and North Macedonia. What is interesting here is that 37% of participants were diagnosed as part of checkup programs in Romania. That proportion is also high, we can see in Poland. And what is also interesting, that Romania, as a country without a national screening program for colorectal carcinoma, has higher percent of participants diagnosed through checkup programs than the other countries which introduced national screening programs have in their screening programs. Technical problems again, thank you. And again, over 60% of participants were not diagnosed through preventive programs, but when they visit the doctor because something went wrong with them. Okay, now we are going to talk about new topic. It's related to waiting time. In this slide, we can see how long did it take to be diagnosed with cancer. And what we can see that over 80% of participants were diagnosed in first 3 months. But there is something going on in Slovenia and probably in Bosnia and Herzegovina. Certain number of participants claimed that they waited for the diagnosis more than 6 months, even more than 1 year. This is needed to be analyzed later to see what is going on about that. Also, we can see that the highest percent of participants that were diagnosed within first months, we can see in Albania, following Bulgaria, and the other countries. That percent was the lowest in Slovakia. We can go on the other.
Just checking your pulse.
Okay. Here we can see that more than 90% of participants started with treatment within 3 months after they were diagnosed with oncological disease. Again, there is something going on in Slovenia. We can also see that more than 50% of participants started with their treatment within first months after they were diagnosed with oncological disease. What was your first treatment? Surgery in more than 50% of participants, followed by chemo. proportion of chemos goes from 20 to 40% from country to country, and after that radiotherapy. And these three therapies takes more than 90% of share in first treatment of oncological disease. This slide, I gave name to this slide. I called it advanced disease paradox. What is going on? This red presents localized disease, and blue parts present advanced disease at the moment of the diagnosis. And we can see that proportion of localized disease is high in Albania, Bosnia, Bulgaria, Romania, and Slovakia. And proportion of participants who were diagnosed in advanced stage in disease is high in Czechia, Croatia, Hungary, Poland, and Slovenia. Why is that strange to me? Because proportion of participants that are diagnosed in advanced stage of disease need to be analyzed. Advanced disease paradox. Okay. I gave also name to this slide and slides after that. What is interesting here, that something is going on in North Macedonia. And we will see that modus operandi and on the other slides that are coming after this one. Participants were asked if they were told to bring a family or friend with them when they were about to first told that they had cancer. And over 60% of participants claimed that they were not being told to bring somebody. And then we can North Macedonia, where more than 60% of participants claimed that they were told. We can inversion of situation in North Macedonia. Something very good is happening there. And Albania and Slovenia, they are somewhere between Macedonia and the other countries. How were you feel when you were told that you had cancer? It's related to communication skills and to empathy. We can see again that the highest proportions of participants who were satisfied with the models they found out that they are real is in North Macedonia. Again, followed with Albania and Slovenia. And the highest proportions of participants who were not that much satisfied, we can see in Poland and Romania. Explain to you. And again, the highest proportion of participants who got enough information we can find in North Macedonia and after that in Slovenia. Also, what is interesting here, that we have 6% of participants who get no explanation in Slovenia, and it goes up to 28 in Serbia. How many conversations did you have with the doctor? Each participant from Romania had at least one conversation with the doctor, and 30% of participants from Albania had more than 3 conversations. They really like to talk. Have you been given a cancer treatment plan? As you can see, we are still on that. There is something going on in North Macedonia. And 65% of participants in North Macedonia got treatment plan. And what is claimed that they don't know what it is. Were the possible side effects explained in a way you could understand? And again, the highest proportions of participants who got information we can find in North Macedonia, following Slovenia and Bosnia and Herzegovina. But we can see there are also high proportions of participants who did not get any information, or who got no information. This slide is connected to the slide before. Here, participants were asked if they got any practical advices. And of course, if they did not get any advice about possible effect size, they didn't get practical advices to support them with dealing with side effects. And proportions in answers are similar to the slide before. Were you involved as much as you wanted in decision about your care and treatment? So this question is about paternalism and autonomy in decision making. And where we can see the higher proportion of autonomy in decision making, again in North Macedonia. And where we can see the highest proportion of paternalism in decision making, we can see that in Serbia and Slovakia. Did hospital staff discuss with you or give you information about the impact cancer should have on your day-to-day activities? Of course, this slide is connected to slides before them. And we have similar proportions as when we ask participants, did you get information about possible effect size and how to deal with those effect size? And we have, again, a high percent of positive answers in North Macedonia, followed with Slovenia. Any benefits? No, but I would like to have that information. We can see that answer in more than 70% of participants. And again, in North Macedonia, 35% of participants got information about financial help and benefits. Did you find someone on the hospital staff to talk about your worries and fears. There is higher probability to find somebody to talk if you are in Albania or Bosnia and Herzegovina or Hungary or North Macedonia or in Slovenia than in the rest of countries. Those slides and those questions before were related to treatment in hospital. This one is related to treatment out of hospital. And again, highest percent of participants who got support, we can see, was in North Macedonia, following with Slovenia and Albania. So, have you noticed that in these slides and 14 slides before, we have groupation of North Macedonia, followed by Slovenia and Albania? Were you given clear written information about what you should or should not do after leaving hospital? And again, we have one situation in North Macedonia and Slovenia, where participants were provided with information, and higher proportion of participants in the other countries which were not provided with information. Did hospital staff tell you who to contact if you were worried about your condition or treatment after you left hospital? And again, that aspect of care seemed to be very good organized in North Macedonia and Slovenia, following Albania, Czechia, and the other countries. This one is very interesting. Did a group of doctors or nurses talk in front of you as if you were not there? More than 40% of participants experienced that behavior. And it would be very good to contact healthcare professionals and to suggest them when we come to that part of quality improvement. I would suggest you to start with this one. I love this slide. Who gave you most confidence and most trust? As we can see, patients believe health professionals. And who gave most confidence? On the first place, they are oncologists, followed by general practitioners and oncology nurses. What is interesting for me, that counselor in support group gave most confidence and most trust in high proportion in Bulgaria, Serbia, and Slovakia. Okay, I don't understand the organization of that support group. Probably you are not surprised with that as much as I am. If you paid for any of your cancer care and treatment yourself, why was this? And participants gave money because they wanted to avoid delays and to get care or treatment they wanted and wasn't available. Very low proportion of participants who gave out-of-pocket money, we can see in Czechia and Slovakia. Did you buy any alternative preparations? Of course, participants from each country are buying alternative preparations, but highest proportion we can see is in Bosnia and Herzegovina, and the lowest is in Poland. And did you inform your doctor about that? And since participants trust to their doctors, of course, they inform doctors about using of alternative treatments.
I don't think they were honest there, but
Do you feel your cancer care is a financial burden for your family? Yes, the highest proportion of participants that think so, we can see is in Albania, and the lowest is in Serbia. But Czechia and Slovakia claimed that they don't have that much out-of-pocket payments. But still consider their illness as financial burden for families. What is your working status since you were diagnosed or treated? I would consider this slide also as one of the aspects of financial burden of disease, because only fully employed participants and probably participants of sick leave receive full monthly income. All the other of participants are receiving some restricted amount of money. Do you have support of your working environment since you were diagnosed or treated? A lot of evidence suggests that social networks and social support from family, friends, and co-workers are the most important predictor of well-being. So we need support. And of course, our participants needed support. But did they get support? Yes. And the highest proportion of participants who got support, we can see, is in Bosnia and Herzegovina and Serbia. Can you talk openly about your disease with friends and family members? Yes, always, and yes, sometimes. We will consider that as yes. And then over 90% of participants can talk with friends and family members, which is very good. Daily routine, of course, was changed due to diagnosis of oncological disease. And we can have that in mind where we are thinking about that social support that patients expect or friends or somebody expect from us. How would you describe your management of treatment side effects? Unsatisfactory, pure or non management, we can see in this part which goes from blue to up. We can see in Albania, Czechia, Poland, and Slovakia. And more than 50%, okay. More than 50% of participants which have excellent or satisfactory management of side effects we can see in the other countries. I don't know how is that connected with countries, but results show something like that. Have you experienced influence of treatment of side effects on your everyday life? All the time, very often, and sometimes, these three colors. And we can see that over 70 participants experience that in all countries, but in North Macedonia again. We don't talk about death and dying enough in these countries. Somehow, in Romania, in Serbia, people are talking about death much often than in the other countries. How often were appointments cancelled by the hospital or clinic you were due to attend? Probability to experience something like that is higher if you are on treatment in Albania than in the other countries. A little bit of statistics. Participants were asked, how would you rate your cancer care from 0 to 10? And then we prepared distribution of score according to the country. In the legend, we can see that what was presented here is median value, interquartile range, and minimum and maximum value. The highest values we can see in Macedonia, and the lowest values in Bulgaria. Okay, this part is not that important. What is interesting to me, here in this table on the right-hand side, in the rows, we can see countries that does not differ one from each other. Countries which are similar in this score. And we came to the conclusions. Healthcare professionals give confidence and trust to participants and their caregivers. Since the main goal of this project was quality improvement, we identify some elements that need to be improved. Delivering of bad news, waiting time, providing information about treatment, providing information about healthcare and social care support. We can go on the other slide. Diagnosed with oncological disease, influence daily routine, it is financial burden for participants and families, and social network support are very welcome. And that's it. Thank you. If you have any questions, I would like to answer.
So, thank you, Slavica. And now, if you have any questions for her, because she was really doing this very thoroughly, and this is just you just scratched the surface of the information that we got. So if you have any questions, she can actually answer you, so please feel free. Perhaps I have a question for you, and especially this goes for my colleagues from patient organizations. How do you feel about the slide when it shows that they don't really have confidence in our organization, and they don't really ask for us to give them advice. How would you comment that? This is a question for all of you.
Mogu ja? But question was most confident.
Yes.
But most confident. Of course, in this part of their life, the most confident goes to healthcare givers. That's it. You cannot expect to be on the first place because. Thank you.
Feel free to comment because it's.
I think that's, the answer is quite natural because when you are in treatment, you have to believe in your physicians, doctors, and so on. We are more, patient organization and more as support by giving an information and so on. As actually at the first stage, and when some problems occur. So we are, So I don't think it's. The answers are not, directly, in our disadvantage. I don't think because, the question was directed to more like, directed to treatment, I think, and this is what we were discussing.
No, I'm asking this because we get actually a lot of questions in Croatia about the treatment choices they are given. So that's why I'm asking you this. It's not uncommon that we have these questions. So that's why I was asking these questions. Maya, would you like to comment what's happening with waiting for the treatment in Slovenia?
Thank you, Ivica. Well, first of all, I would like to say hello to everybody. I am a veteran here for the third time to be here, so thank you for the invitation. And Ivica, congratulations from all my heart for all the hard work that you and your team have been doing. Okay, really. Okay, and as for the results of the service, so my impression is that North Macedonia is the place to go to be treated for your cancer. So to my surprise, but still. Okay, the second surprise is the results for Slovenia, where I come from, and I must say that the surprise is not a pleasant one, and I would really like a more deep insight into the results. And as for the waiting time between the first symptoms and the start of the treatment, I would be interested in the age of those patients because my idea, well, I hope this is right, is that those were younger patients because at least in Slovenia, when a younger patient has problems and visits their doctor, they are very often turned down by saying, well, you are much too young to be thinking about cancer, let alone to have one. So it might be, that they were young. Okay, hopefully. And then again, about 30% of patients were diagnosed in Slovenia in advanced or metastatic stage, which is really a bad surprise again, because like Professor said, in Slovenia, we've got 3 national screening programs, which are really, really good, and we are very proud of them. But then again, maybe we should rethink this. And for the patient organizations, it is true that when you are diagnosed, I suppose that your oncologist is the person to turn to. But I would really like to know what the results would be if patients were asked later on into their disease, who they would turn to, because we might be disappointed then again, because, in Slovenia at least, only about between 5 and 10% of all patients are actually members of patient organizations that they should really turn to. So maybe we should rethink our role as patient organizations one more time. Okay.
So I have to say I forgot to thank one very important person. Katerina, where are you? Katerina, she's not here. So, okay, part of you know Katerina, who doesn't, I will introduce introduce them to you, because Katerina was the god fairy mother of IT for all for everything that was going on with this project, and without her we would be actually powerless. So thank you, Katerina. I will thank you again later on. So Alin, you said you had a lot of experience. What do you think about what you just heard?
Yeah, I saw the results, and it was kind of a shock for me. Uh, um, the part with the support groups in Romania, we are a federation formed with 26 local organizations who organize support groups in 14 cities and in hospitals. And now with the support of the Roche, we involve doctors and nutritionists and psychologists for months and working. And I saw those results, and it's kind of scary because the fact actually is not so scary because it will determine us to increase our capacity in our organization to be more closer to patients at the lowest level, you know. So, and I was having a question actually. If we want to design some kind of a project from living from any of those results, can we get some support in order to create some small guidelines for a project to implement in our countries?
We will have the entire patient groups workshop in the afternoon after the lunch, and then we will discuss how can we utilize this data and how could we possibly develop some project from it. And everyone who were coming previous years, they know that this was actually a closed meeting, and the Roche staff would come and stay for like 2 hours, and then we had the meeting with the we were going parallelly with the Central and Eastern Oncology Congress, and then we would have their advisory board to come and have lunch with us and talk about some subjects. And that's why it's important that we have oncology specialists with us for both 2 days and involved in this workshop to see what can we do actually together. So perhaps I should ask Adriana. Adriana, what did you do in Macedonia to have such good results on the interpersonal level between patient and healthcare professionals?
Well, it's not a shock to me, actually. We are naturally friendly people and empathetic. The patient organizations are not that developed, so I think people do trust more oncologists. As of the organizations of treatment plans and post-treatment plans, I was a cancer patient, so I was 12 when that happened, and I don't know, that's how it works. They give you a plan always, for everyone actually. But now what we do is we educate young medicine students for how to give psychological help and how to tell the parents and the children that they have cancer.
Thank you, Adriana. And I think Simona wanted to comment something on that because you were listening.
Can I study in your country, please?
Okay. Does anyone else has any question? Yes? Sorry, I will come.
I'm oncologist, so I'm really shocked to see all these results. We talk to the I'm from Sarajevo. We every day talk to the patients because we don't have in hospital any psychological help for patients and for the doctors. We need that too. So this is a little bit shocking for me. For the answer why, I was just commenting with Nella about why don't patients trust to patients with organizations. That's because during the treatment, they see us. Everything is happening so fast. They don't have time to see, yes. But after the treatment, they have the enormous support from the patient organizations. So I think that's the reason why the answer is like that. My question is, I saw the question about the death, something like, do we need to talk about that with the patients? I don't think that's a good idea. Or is there a need? I want to see if there is need to talk about that. Thank you.
Try to explain. It's about death. This is actually something also for the workshop later on, but I can say it from the Croatian perspective. We have this problem with getting the right treatment at right time. And sometimes you are in so highly advanced disease that you don't really have any benefit from the treatment, and they still give it to you instead of giving you palliative care and palliative treatment and make it possible for you to go dignifiedly. So with dignity. So it's something that we need to talk about. And actually, I only heard one medical professional who was talking about it for 5 years that I'm on the scene, let's say. And this is a subject that we need to talk about. And actually, we didn't pull up slides here, but you will get it via email. But you will see how many people, like 80% of people didn't prepare themselves for that. They didn't write a will. They didn't think who will care for their children. This is something that we really need to, because it's important part of the entire cancer patient pathway. Because sometimes it ends there. It doesn't have to, but it can, and you have to know what to do in that period of time. Yormis.
For me, it was very impressive results. Some make sense and some do not make sense from my perspective, but still give me insight. And the one question that how much do they need the patient associations or look after patient associations? It makes sense at some point, of course, as the others explained, to look at oncologists. And I wonder if there was any specific question after oncologists, what they need. The other insight, if it is so low, do patient associations offer what they need? Do they know what patient needs? And we were struggling for years in Albania with low participation in patients' associations. Now we have some well-established patient associations, but still, the question remains, does this organization knows what patient needs? If I am a patient, of course I look after oncologists. But after that, do I get in touch immediately with the patient association, and do I understand immediately the benefit I can get? So this is some good insight we need to think, yeah.
So I think this is on the line what Maya said before, that we actually, all of us have to rethink our role and rethink what we as organizations are doing and what we are offering. And I think this is a good challenge for us. And so now it's 11:15. We were actually rather quick, but if we all agree, we can make some coffee break so you can relax a bit, and we will be back at